So I remember the day that George Floyd was murdered. It was Monday, May 25th. I was in the ICU at the time. My day off was that Friday, the 29th. And up until that point, I hadn't really processed what was going on, but I finally sat down on Friday and kind of thought through all of it. And as soon as it all kind of sank in, I was broken. And basically all I did was cry that Friday. I think his murder hit me particularly hard because, my dad's birthday was the following day, that Saturday, and my brother's was on Sunday. And all I could think about was how that could have easily been one of them if they were stopped by the wrong cop one day. So that Friday, things kind of boiled over, and for the first time in a very long time, I decided to say something. Prior to that Friday, I was never really one to talk about racism at work, and I was just always worried about making people too uncomfortable or, being the angry Black woman. But I think that day I realized how grossly wrong that thinking was, and I decided to share my hurt and some of my expectations with my co-residents and program leadership. And that was received really well. We had so many amazing conversations and lots of great initiatives have come out of this, but this is just the beginning. We cannot afford to ignore racism anymore. We, as healthcare providers, doctors, hospital systems, it is not magically stopped from entering our hospitals by some entity. It doesn't need an ID badge. It doesn't need a COVID day pass. It's here. It's in our hospital. It's in the way that we treat our patients. It's in the access that our patients have to resources or lack thereof in some cases. And it's within some of us, and whether we know it or not. And that is something that we have to recognize. We have to be uncomfortable with that, address it, and work on it. And that work is really hard. It's lifelong work. It's a marathon. It's taxing. It's uncomfortable. It's hard, but it's no longer optional for any of us to do that work. This is our job. This is our role. This is what we have to do. And the question is, what are we doing about it?